Hi, everybody, and welcome. My name is Katerina Mokrua. I'm a member of the Public Education Committee for ADAA. That's the Anxiety and Depression Association of America. Welcome to our webinar today. What is psychological trauma and when do I seek treatment? Presented by Dr. Christian Blanco-Oylar. But before we start, I'd like to say a little bit about ADAA, the Anxiety and Depression Association of America. ADAA is the leading nonprofit organization in the field of anxiety and depression. Our mission is to improve diagnosis and promote the prevention, treatment, and cure of anxiety, depression, and stress-related disorders through education, like this webinar, practice, and research. We work to end stigma and to get the word out that these conditions are real, serious, and treatable. I want to invite you to visit the ADAA website. It's a fabulous resource. That's adaa.org. You'll find a great list of treatment providers, as well as free peer-to-peer online support group. And you can support ADAA by making a charitable donation on the website. Okay, so let's get started. I am happy to present you to our presenter for today. We have Dr. Christian Blanco-Oylar, who will be presenting on the topic, what is psychological trauma and when do I seek treatment? There you go, Dr. Oylar.
Thank you so much, and thank you so much for giving me this opportunity to have this conversation with you today. I wanted to start by addressing the definition of what trauma is, since it is a word that can be widely used sometimes, and we may not be 100% sure about what it all entails and what it means. And I would like to also address some of the most common questions that I hear from people that I speak with, from clients that I have the privilege of working with as well. So for the purposes of today's conversation, we're going to be defining psychological trauma as an adverse experience that we have in life that really challenges, in some ways even threatens, our understanding of the world, either our individual world and the way that we go around it, or the larger sense of the world. And so this is a very broad definition, so I'm going to illustrate it with some examples of what can be traumatic experiences for different people. This is not an inclusive list, but some examples can be car accidents. It can be the tragic loss of a loved one. Trauma can be experiences of racism and homophobia. Trauma can be sexual abuse, sexual assault, interpersonal violence, war experiences, going through a natural disaster. So as you can hear, even when you hear these examples, a lot of us go through traumatic experiences throughout our life. The experience of trauma is subjective, and what that means is that each of us experiences trauma differently based on who we are and our different life experiences and even our cultural backgrounds. But what's true is that trauma affects all of us as humans because of the way that our brains are designed to navigate the world and the way that our brains are designed to react in very normal ways to what can be very abnormal situations. So what I want to highlight in today's conversation is that these traumatic reactions are themselves normal ways of responding to very extreme situations. And the way that we react to trauma, the stress reaction that we have, we all have it. It's just that it varies the level at which it will affect different people. So a lot of times people will ask me, why is it that some people exposed to a trauma will develop a traumatic stress disorder? The most commonly one known is PTSD, as opposed to other people who are exposed to the very same trauma, and they seem to on their own heal and get better faster. And that's a great question that there's been a lot of research that has been trying to address this question so that we can better understand it. And as complex as the question is, the answer can be a little bit complex too, but the reality is that there are a lot of individual differences that will inform how we react to trauma and the way that trauma affects us. If we think about it even individually on our day-to-day life, we may have a day where we face a certain number of stressors in that day, and we manage to get through that day by the evening, feel pretty okay with our ability to have managed all that stress and feeling pretty grounded and overall well taken care of. We go through our evening in the usual way. And yet some other day, we ourselves may go through the day and face the same amount of stressors, and somehow they can overwhelm us on that different day. We might come home feeling very irritable, very overwhelmed, very exhausted, kind of just wanting to shut down from the world. And what may have made that difference between one day and the next could be as simple as the fact that we didn't get a good night's sleep the night before, or that maybe the previous day was also overloaded with stressors and we just didn't have enough time to recover. And so if that's the case, even just at an individual level, going through day-to-day experiences, imagine the same, but at a level where we're experiencing trauma. If we experience a traumatic incident and we through our life have survived many other traumatic incidents, we may then have a different response from someone who's going through a traumatic experience for the first time in their lives. So.
Can I ask you then, how much time would an individual need to allow themselves to figure out if they are recovering naturally, as opposed to seeing these symptoms and the symptoms kind of persisting? Is there a way to distinguish? Because it sounds like some of the traumatic symptoms or reactions may be hard to distinguish initially.
Yes, you are right. They can be very hard to distinguish, and that's a great question because timing is really everything. When we go through a traumatic experience, most of us will be affected by it initially for the first few days, even the first few weeks. Usually in order for us to meet the criteria for post-traumatic stress disorder, a good 4 to 6 weeks will have passed where we are still being very overwhelmed by the symptoms of a traumatic reaction. And the key word here is that these symptoms begin to interfere with our day-to-day functioning. So both the timing, the 4 to 6 weeks average, as well as the interference with our day-to-day life are two important factors that we need to keep an eye on that can indicate that we might need to seek further support.
So allowing for time to pass to see if it is still persistent and if it makes a difference in how we function on a day-to-day basis.
Yes, and I think it's also important to have a very good understanding of what those symptoms are, so that we can also engage in a lot of self-care and either of ourselves or a loved one who is recovering from a traumatic event. So some of the symptoms I think in the general culture are very familiar with, and some of the symptoms we might not, and people might be surprised to experience themselves. And there's nothing more empowering when you are recovering from a traumatic incident than understanding that what you're going through is expected, and what you're going through again is normal, as opposed to going through these experiences, having these reactions, and not knowing what's going on and why it's happening. So that's why I wanted to make sure to go over the symptoms today. Some of the most common symptoms that people hear about are the intrusive symptoms. These are symptoms where we may relive or re-experience a traumatic event. So things such as nightmares, flashbacks, those are symptoms that a lot of people have heard about, or even triggers. What a trigger is going through your day and seeing or hearing or even feeling emotionally something that causes you to relive or re-experience a traumatic event. Flashbacks are intrusive images, usually visual images, of the experience that was traumatic. And of course, we all know what nightmares are. So these are the intrusive symptoms of post-traumatic stress disorder. But then we also have other symptoms that are less known about. And a very important one to look out for is avoidance. When we go through something very traumatic, we may then find ourselves having a very strong desire to avoid whatever it is that reminds us of that terrifying experience. So we might, for instance, want to avoid crowds of people because we're not feeling safe, we're not feeling that the world is safe, or we might be avoiding driving after we've been in a car accident, or avoiding watching certain things on TV that remind us about the trauma. Or to an extreme, we might find ourselves avoiding people altogether because people may want to ask us how we're doing or what it was like to go through what we just went through, and we may really not want to answer those questions. So social isolation can be one of the things that can happen. In addition to this, we have also some negative changes in our beliefs and our feelings about ourselves and about the world. A lot of people who experience trauma may find themselves feeling a lot of feelings of shame and guilt, or feeling the sense that it's very difficult to trust others or feel safe in the world, as I mentioned earlier. And it may become very difficult to find joy in the things that we used to find joy in. And last but not least, also, we may experience what we call hyperarousal, which is basically being very keyed up. So very easy to startle, having a very difficult time sleeping. That can be a very intrusive symptom. Having a hard time concentrating, just feeling on edge. Those are some of the main symptoms that I wanted to highlight.
Now, is the avoidance very obvious, or it sounds like it's something that can feel almost justified, something that a person can easily tell themselves, it's just, why bother? I want to just take it easy. I've been through this terrible thing. I don't want to have to push myself into doing what I was doing before so quickly. In other words, do you often see or hear rationale that sound perfectly reasonable, but for behaviors that seem perfectly reasonable given the traumatic event, but in fact they're avoidance?
Absolutely, yes. That's a great question. It is very hard. It's very nuanced also. And again, here's where people can bring in their individual differences to this. Some people may need, for instance, more level of social interaction than others. But it's all about that balance. So it is very understandable initially to want to stay low and to want to just be home and to try to be around calm surroundings. This is where timing then becomes important. If a lot of time has passed and that social isolation is increasing rather than decreasing, then that may be a sign that that justification is extending into a behavior that's ultimately not helpful.
Good to know.
There's also a difference that I wanted to chat about today between how we experience trauma when it is a single event versus when we go through life being exposed to chronic trauma. And I wanted to make this differentiation because of how very important it is, given that the treatment for these two types of trauma can look entirely different. So the most commonly used term for this difference is single event PTSD, and that's what most people have heard about, versus complex PTSD or complex trauma. And complex trauma or complex PTSD is, again, when a person has been exposed to chronic levels of trauma, especially from a very young age. So when we come from very difficult childhoods where we were exposed to violence or abuse or neglect or a combination of all of this, this is what we call developmental trauma or complex trauma. And again, the treatment for it is very different. And I can go into that a little bit more a little bit later.
Sure, sure.
Before I go into that, I just wanted to mention for listeners that it takes a tremendous amount of strength and courage for really any of us to get through traumatic events. And when we are at a place in our lives where how we react to this traumatic event begins to tell us that maybe we are in a place where we do need further support because we may be developing the symptoms of PTSD, in order to, just to be able to recognize that within ourselves and to be able to reach out for help, to realize that PTSD can be healed and that there is hope. That is something that I am always in awe about just how much courage and strength it takes for people to know this and for people to reach out for that support. And I can tell people, our listeners, that just about every, if not every, professional that I have met who specializes in trauma, who works with trauma survivors, will approach your healing journey with this recognition of your strength and your courage. And I'm saying this because still to this day in this world, we do have a lot of stigma still in our society about mental health, about trauma, about PTSD, about therapy. And I think, you know, part of battling that stigma is, again, to normalize that this is a normal reaction to an abnormal situation, and that there's just so much strength and courage involved in the healing process. And there are a lot of people who are ready and willing to support those who are surviving those experiences.
I'm so glad you took the time to say that. I think that's absolutely the case with so many struggles people have, and it is a sign of courage to allow or give the opportunity for someone to be there to support and help you heal.
Yes, thank you. Yes. You know, it's, I think that the part that I want to speak to is also, you know, how a question that I hear very often from people is, how do I even go about seeking that treatment or helping my loved one seek that treatment? If I'm really concerned about a loved one, you know, how do I speak to them, and how do I find a professional who is trained in supporting survivors of trauma? And this is where I want to highlight some of the differences between PTSD and complex trauma. What we know from the research, there's a lot of research on the treatment of both of these experiences. For PTSD, research very, very strongly supports different approaches. Cognitive behavioral therapies are very strongly indicated for PTSD, and these are therapies that are going to help us make the connections between our thoughts, our behaviors, and our emotions, and pay a lot of attention to the thought processes and the different behaviors that we can change so that we can ultimately impact that emotional experience and healing that can take place. There are specialized cognitive behavioral therapies such as cognitive processing therapy that are designed specifically for PTSD that have a lot of empirical support. So when you're looking for a therapist who specializes in trauma, this is some of the language that's important to look for. And also there is a treatment called EMDR, which stands for eye movement desensitization reprocessing therapy that can be very, very helpful for single events, single event traumas or for single event PTSD. For complex trauma, the research indicates that the treatment can look a little bit different. And so looking for a therapist who's specialized in complex trauma is very important. That person is going to approach treatment a little bit differently. It requires a different level of training, and it requires the utilization of a lot of different techniques. Cognitive behavioral therapy may be one piece of a much larger puzzle. EMDR might be part of it too, but it's a much more comprehensive approach that that you need to look for the specialty in order to really know that you're going to be in good hands.
Will you be able to speak a bit more to the differences in the various approaches, and maybe also what are some misconceptions or misperceptions people have about these evidence-based approaches that prevent people from seeking them out? Are there different aspects that people are a bit leery about, that they've heard about, that they worry that they're not quite ready for?
Yes, thank you. That's a great question. I think there is, well, I'll speak more to the differentiation. For instance, the research, for example, supports very strongly exposure therapies with the healing of simple PTSD. And so exposure therapy means that in the context of a safe therapeutic environment, you do face the details of the trauma that you experience, but you do it in a supported and trained way so that you can remember the trauma without re-experiencing it, if that makes sense, so that you can think about what happened to you without feeling completely overwhelmed and overloaded. Exposure therapists will assist you in doing this. Now, the research does not support exposure therapy for complex trauma. And so that's one of these differences that is important to keep in mind. What I want everyone to know, especially with complex trauma, is that there are a lot of therapies out there that are evidence-based, including EMDR, by the way, where I like to really tell people that they don't actually have to relieve, re-experience, or go through their trauma, even in the therapy room when they're with me, in order to heal. I think that's one myth. The myth would be that in order to heal from the trauma, you have to go over all the gory details with your therapist. And the truth is that you do not. The focus is on your coping. The focus is on your self-care and of having a general narrative of the trauma that allows you to integrate it to your life narrative. And that can be done without having to recall all the details of your trauma. I hope that this addresses part of your question.
Yes, certainly. So what I'm saying, what I'm hearing you say is that there are ways to work with a therapist trained in these types of approaches to be able to have a different understanding of the trauma
Mm-hmm.
without having to face it over and over again. So,
Yes.
so when you talk about exposure, that term, I think a lot of people are maybe startled by, because it might
Mm-hmm.
sound like you're re-exposing yourself to the
Yes.
very danger that you experienced, but in fact, it's not necessarily what folks bring to mind when they think of the word exposure.
That's right. Yes, yes, that's correct. And I think that's important to highlight because one of the symptoms of trauma is avoidance. And so if you are feeling very traumatized and somebody tells you, well, you need to go to therapy, where the myth is again that you're going to have to face what you're trying to avoid, that's going to keep a lot of people away from therapy, and that's
Mhm,
a true sad disservice. Yes.
mhm. Okay, so the differences between exposure therapy and the other approaches, cognitive processing, how do people determine which of these approaches are best for them? I imagine that there are differences between the two. Do you find that some people respond better to one
Mm-hmm. Yes.
than the other?
Yes, I think that it is very important to, for instance, as a clinician, to be very flexible, always informed by the research and the evidence-based treatments, but also to tailor your work to the individual needs of your client. I have clients who have responded incredibly well to EMDR, for example, and for some clients, it's just really not a good fit, and so I will use a different approach for those clients. We all are different. Our cultural backgrounds may inform, our own stories may inform just how we respond to different things. So there is value in different approaches, and a trauma specialist will come to the table trained in several of these components so that they can tailor their treatment to the individual needs of clients.
Okay. So, for example, if nightmares is something that is particularly troublesome to one, whereas avoidance and flashbacks or other clusters of symptoms are more problematic to another person, you might take that into account along with a host of other factors.
Exactly, absolutely. So the first initial goal when I see a client is to get to know the client very well and to understand exactly what you're saying, how they are individually reacting to the traumatic incident, so that we can then personalize that treatment plan and address what's most present, stabilize first and foremost, and then in collaboration with the client make decisions about what treatment approaches to use in order to process the trauma.
Hmm.
I hope I answered your question.
Yes, yes, thank you so much. That's really helps clarify the differences. I think a lot of people are not quite sure that there are evidence-based approaches out there, that there are ones that with different focus,
Mhm.
and that many, well reputed trauma specialists should be able to tailor their training to the various client cases in front of them. So that's very helpful to know. So I think I see the slide that you have up here, which is how to help a family or a friend. It's one thing when it's you dealing with it, but if you see somebody you care about, somebody you love,
Yes.
struggling with some PTSD symptoms, that brings a host of other concerns, I imagine, in trying to get them to get help.
Yes, thank you. Yes, I did stop on that slide, didn't I? It's a good reminder, though, because this is another very common question that we hear a lot. How do I help somebody that I love? And so, of course, the do's are about, of course, offering your support. And And sometimes the most supportive one can be with a family member, a loved one who's really, really struggling, is to just be present and to just show up. This is really not about knowing exactly the right thing to say to someone. But it's also about staying open, because sometimes even when we do show up for our loved ones, we might say something that we think is helpful, and we might get different feedback from the reaction of our loved one, or even they may say, you know, I'm not sure how helpful that is. And because we are learning today that everybody responds to trauma a little bit differently, I think it's important to stay very open-minded. So expressing our concern for our loved one is a very okay thing to do. And I think it's very helpful to do that from the perspective of what each of us is experiencing about our family member. So, you know, starting a conversation with, hey, I'm very concerned because I have noticed X and Y and Z is a much more effective way to open up dialogue, rather than coming at it from a way where we're starting the conversation with, well, you are doing this and you are doing that and you are doing the other. Does that make sense? So using I statements and speaking about your concern for the person and how much you want to help, maybe even sharing that, and sometimes this is true, that we're not exactly sure how to help, and that's okay to admit as well. And to then try to link that up with referral to a professional. Sometimes, you know, many of us have been in therapy before, and so sometimes it's as simple as saying, hey, remember when I was going through a rough time a few years ago that I shared with you at some point that I had been in therapy. I found it super helpful. This is how it helped. I was thinking that maybe would you be open right now, that may be something helpful for you, something very supportive like that. I think what's important to stay away from is to try to give a whole lot of advice, because ultimately, unfortunately, that may turn into the person feeling judged or ostracized, even if that is not our intent. Mm-hmm. And so to not try to give a whole lot of advice, to try to not be critical or speak in any way that may seem judgmental, but just to be very humble in our approach and speaking from our own experience of that person, to share how much we love them and we're concerned for them, and to also take very good care of ourselves, especially when a family member is struggling a lot after a traumatic incident. We can become so very absorbed and concerned with the well-being of that family member that we may forget about ourselves. But when we begin to take very good care of ourselves, that's kind of a way of modeling for that family member that it's healthy and that it's okay to pay attention to ourselves. And we help others much better when we come at it from a place of being healthy ourselves. And I also put up some resources online for people to go to for more information, in hopes that it can be helpful.
Okay, so it seems like you're suggesting to what's the best way, or one of the potential ways to broach the subject of help is to present from a place of concern concrete examples of ways in which you see the family member or friends suffering, taking or neglecting themselves, or ways in which they have changed. Mm-hmm. So kind of presenting concrete examples as evidence, so to speak, of why you're concerned, mm-hmm. and inviting them to have a dialogue with you about that. So, for example, I noticed that you haven't seen your friend in 3 weeks, and she's been calling you, asking you to go out every day. That makes me concerned. At one point, you used to love going out with your friend. Is everything okay? Just yes. To kind of engage at that level and express concern that way, as opposed to saying, you know, I think you really need to
yes.
pass judgment, or, you know, I think you really need to get out there. Why are you alone? Exactly. You are isolating yourself. So even though yes. both both manners certainly communicate concern. One is more amenable to engaging with the family member or friend.
Yes, you said it very well. Thank you. Yes.
Okay. And I think it's great to remember that you need to take care of yourself too, because if you are just as run down as your family or friend that you're concerned about, you're probably not going to be able to express your concern in a um, kind of from a grounded place, so to speak, from a balanced place.
Yes, that's right. Yes,
Yeah.
very important to not forget about ourselves.
What would you suggest if they are not, even after broaching the topic and they're just really convinced that they don't want to see anyone, they're just not ready and they think it'll just get better on its own. What do you suggest people say or folks
hmm
say to the family member?
Yes, and that may very well happen. And so I think it's important to then respect that
Mhm.
and to communicate to the person that you're here for them, and that, and to ask them if there's anything that I can do, please let me know. I'm here for you for anything that you need. And maybe even sometimes we might make the decision to go seek help ourselves. And again, that models that behavior. And it also allows us to engage in that self-care because it can be very stressful when we see a loved one struggling and they're deciding at that moment not to go seek further support.
Okay, thank you for that.
Thank you. Um, I think that's all I had for today, unless you had any further questions.
We actually asked a couple of clinicians in the field and of other folks in the field if when we talked about this presentation being recorded soon, and there was a question about, is there a place for hypnosis in this treatment? There've been discussions here and there about repressed memories and of trauma. Is that something that you often find in this treatment? So I guess two aspects really, the idea of repressed trauma and the idea of using hypnosis as part of either assessment or treatment. What are your thoughts on those two?
Yes, that's a very important question. And the topic of repressed trauma has been very controversial over the years. But if you recall, in the very initial part of our conversation today, when we were going over some of the avoidance symptoms, one of the symptoms of post-traumatic stress disorder is to forget aspects of the trauma. And so it's natural to imagine, I guess, that since that is one of the potential symptoms of PTSD, that there could be something such as repressed trauma. The brain can sometimes get overloaded when it feels presented with a piece of experience or information that it just cannot process adequately or process in the way that it's used to process our everyday life. And I have encountered in working with trauma survivors over the years that sense of beginning to remember things that they hadn't remembered before. It is possible for that to take place. It also works the other way around. For instance, sometimes with EMDR treatment, it can happen that after a client has processed a traumatic experience, they will remember it differently. Now, this doesn't mean that they repressed it, but it does mean that the memory changes. Memories do change over time. That we know. That is a fact. So it is logical to think that there is such a thing as repressed trauma, repressed memories. What's very challenging to do, though, is, let's say that somebody has a strong feeling that they may have a repressed memory and they come to therapy to remember. That's harder to do. They may or may not remember in therapy. That we cannot guarantee. As far as hypnosis goes, I don't think, actually I know that hypnosis is currently not listed as one of the evidence-based treatments. And in fact, just yesterday, the American Psychological Association, or if not yesterday, very recently, published the new guidelines for PTSD treatment. And hypnosis is not listed as one of those evidence-based treatments. However, I would be very interested to look at some of the most recent literature, and maybe in the future it might be listed as an evidence-based treatment. It just is not currently.
Okay, that sounds very clear that it's not currently listed. There doesn't seem to be enough evidence to suggest that it should be a go-to option for folks with PTSD or complex PTSD at this stage. And it sounds to me like the whole issue of repressed memory, it's very tricky and seems like need to approach very carefully whether or not memories can be recovered in the form that is accurate and reflects what actually happened. So just to be cautious around that is the message I'm hearing, even though you didn't say in those words.
You said it perfectly, yes.
Okay, all right. Another question that was put forward was the idea that can the traumatic event occur when someone close to you is harmed, but you yourself didn't witness it. So learning that your child was nearly killed, but you weren't necessarily there.
Oh, yes. Yes, absolutely. Absolutely. That can be one of the ways in which we can become traumatized, no doubt. Also witnessing violence or witnessing something traumatic happen to another human being, even if they're not as close to us as a child, can also be traumatic. Yes.
I think what comes to mind is 9/11 and just seeing images of the towers coming down, even though people weren't necessarily there or knew anyone. If I'm remembering correctly, quite a few individuals also experienced PTSD as a result.
Absolutely, absolutely. And there even is a term called vicarious trauma that can happen when you're exposed to somebody else's trauma. Yes.
Okay, that helps to clarify many of these questions. And one last question I have is, do you find if there are characteristics in patients or clients who are seeking help that seems to be predictive, if you will, of doing well in any particular approach, or maybe across all approach? I mean, are there characteristics you think it's good to kind of take note of or be aware of for folks who might be considering getting help?
Yes, well, what comes to mind, I hope, answers your question. I think humans in general have an incredible capacity for resilience, for healing. This is part of why I'm so passionate about my work, because it is absolutely humbling to witness everybody that I work with, their strength and their resilience and their willingness to hang in there to the notion that there is hope even when things get so hard. I have not worked with anyone that didn't have this. It's like if you cut yourself with a knife when you're fixing supper, if you look at that cut, you will immediately see that your body starts an immediate process of healing. And the same happens with our brains. We are capable of sustaining a lot, and it's very humbling to witness that, and it's a constant reminder that humans are resilient.
That's such a powerful message to, I think, wrap up the presentation with, that we are capable of healing, we are resilient, and that there's hope, there's help out there. And it does take courage to find it. It takes a little homework trying to figure out which practitioner has the expertise in doing these types of approaches, these treatments, but it's worth it in that there's help out there.
There is, yes. And one last very thing for those who may be looking for the practitioners, don't be afraid to call and interview your therapist and ask them questions and make sure that you feel comfortable with their answers. That can be a very good sign that it can be a good working relationship when you approach it that way.
Oh, that's a great idea. What are some key questions would you say to ask the potential therapist?
A good question to ask is to ask the therapist, tell them a little bit about what you're struggling with or why you're seeking therapy, and then ask them, how would you approach your work with a client such as myself? That's a good question to ask, and that'll give you a pretty good sense of how that therapist approaches their work.
Fantastic. Thank you so much, Dr. Blanca Oylar.
Thank you so much.
Let me take the controls back, and here we are. This was Dr. Oylar. She is a trauma specialist at the Center for Treatment of Anxiety and Mood Disorders in Delray Beach, Florida. And this is the contact information for the Center for the Treatment of Anxiety and Mood Disorders in Delray Beach, Florida. Dr. Blanco has shared this information, so if you want to reach out to the center, certainly this is the contact information to do so. And thank you all for participating in this webinar, What is Psychological Trauma and When Do I Seek Treatment? And if you have any lingering questions after watching this webinar, please email your questions to webinars, WEBINARS, @ADAA.org. Questions and answers will be posted on an ongoing basis on the monthly webinars website right underneath the call out for this webinar. Thank you. Goodbye for now, and we will see you again next time. Bye-bye.